On the 27th of February 2020, the Nigerian government reported the first confirmed case of COVID-19 in the country. An Italian man working in Ogun State had returned to the country from Milan, Italy on the 25th of February. He then went to Ogun State and then he started to show symptoms. He was brought back to Lagos State and treated at the Yaba Infectious Diseases Hospital, and since then, Nigeria has recorded over 150,000 cases of COVID-19. The country has also recorded over 1,800 deaths. Now, while Nigeria has definitely had experience handling past outbreaks before, like the deadly Ebola epidemic that came into the country in July 2014, a pandemic is an event that the world has not seen since the Spanish flu in 1918. Well, where are we 1 year later? This is Track and Trace, Nigeria's COVID anniversary. Lagos, the epicenter of COVID-19 in Nigeria, and it has been since the start of the pandemic. With a higher population density than any other state in the country, and being the commercial capital, it's understandable as to why. But how ready was the Lagos state government to handle tens of thousands of cases of COVID-19?
We went from the end of our Ebola outbreak in 2015. We started to build capacity. The Ebola outbreak exposed a significant amount of gaps in our system, in both infrastructure, human resources. So we started building up our capabilities in Lagos in terms of infrastructure, in terms of manpower, training. And then in December of 2019, we started hearing about the Wuhan virus.
Although the state government was ready, capacity was still limited. Professor Abayomi explained how the state had to grow in capacity. And to do this, private healthcare facilities had to step in.
So at the beginning, our main isolation center is Yaba, the infectious disease hospital. We had already started building expansion there, so we had about 300 beds in there. With the advent of the index case, we continued to expand. We opened up some other centers like the Bagada Isolation Center. We had partnerships with the private sector. We were able to open Onikon and the Landmark, the Indo Isolation Center, and then private hospitals opened up their own isolation centers. So we had close to about 9 across the state.
On the 27th of June 2020, exactly 4 months after the first confirmed case of the virus, the Lagos state government announced that it was expanding its COVID-19 response with the accreditation of 7 private laboratories for testing and 3 private hospitals for case management. Dr. Ngozi Onya is the managing director of Paylon Memorial Hospital. She went through the process of accreditation early on, as she knew there was no escaping this. About 70% of healthcare in Nigeria is provided by private companies, so preparation was a must.
The second wave was a big wave, much bigger than the first, but I think also for several reasons. After the first wave, quite a few of the other private providers shut down. And I think the main reason being that not other private providers were providing regular services from the same premises as they were providing COVID services. So it was a bit disruptive. We didn't need to shut down because we had a standalone COVID center, and so we didn't shut down. So I think at the point when I was feeling overwhelmed, the second wave was just beginning, and we were probably the only private provider, so we were overwhelmed at the point. And yes, it was a much bigger wave. We've seen twice as many patients in the second wave than we did in the first.
Most healthcare workers haven't experienced anything this drastic in all of their years of practice, working longer shifts than they've ever had, having limited or no bed spaces available, and having to make ethical choices with limited equipment for treatment. I spoke to Dr. Seyi Oyeshola, who is the head doctor of the intensive care unit at First Cardiology Consultants Hospital, also in Lagos.
My typical day starts with a ward round. I have to go around, see patients who are already on admission or have very recently been admitted. to review their progress, their laboratory results, their drugs, because they often are on quite a bit of medication. Some of it needs to be stopped, some of it started, and sometimes you just need to modify the dose. And this is a daily event. They have their bloods done every day, and we review all of that. And so it goes on. If the patients in intensive care are many or are very sick, we may need to be there all day and sometimes all night. But otherwise, it's pretty intensive, if I may use the term.
And doctors are not the only healthcare workers that have stood up for humanity over the past year. Matron Uche Emedo, a COVID-19 response nurse at Pelon Memorial, has worked every single day since the pandemic hit Nigeria.
As matron, it's been hectic. Your phone is not switched off. You're always there for them, and then also ensuring that things are done properly. Your role, you need to supervise the nurses, ensure that whatever you learned, because if you don't carry that role properly, you find out that you have a lot of infection in-house, and we've been very fortunate in that aspect in Pelon that the nurses, we've had nurses that are infected, but then it's been very few. It's been under control. For that, I'm very grateful to God.
Lagos State and Ogun State were the first to lock down when the pandemic hit Nigeria. With Ogun bordering Lagos, the state had to prepare for high case numbers. But tracking and tracing was not easy.
As you know, there is close proximity between Lagos and Ogun State. We share borders. So some of our communities that border Lagos, we found that we had hotspots, particularly Ota. On the 27th of February, an Italian man was diagnosed with fever in a nearby facility, actually a factory not far from here. And there was a very astute young doctor, a young lady who had been for training on COVID, and when the history was taken and the gentleman said he was coming from Italy at the time, Milan was the epicenter, so she immediately caught on to that and took some samples, referred the gentleman to Lagos, which was the referral center for COVID-19 at the inception. And following that, we had to take care of the 40 contacts that this gentleman had had whilst on the facility.
The Yaba Infectious Disease Hospital was constructed in 2014 during the Ebola outbreak. And at the start of the COVID-19 pandemic in Nigeria, it was one of just 4 isolation and treatment centers in the country.
We did find one transmission from that Italian index case to a Nigerian in Ogun State. We brought him in for isolation and treatment, and he recovered very quickly. So from that index case, we only had one transmission.
Experience with past epidemics and knowing there was no escaping this. The reality that led frontline health professionals to act and act proactively. But just how much have they had to go through and experience over the past year? And how much progress has been made in the fight against COVID-19?
The story will continue after this break.
It has been a very intensive year, a very demanding year, demanding in point of time and resources. And I'm very happy and pleased for the cooperation we have had. The risk was that the COVID-19 pandemic will overshadow routine health services, which we have struggled very hard to make sure they didn't happen, and also mobilize the various departments responsible for routine services to make sure that we don't lose people while paying too much, giving all our attention to COVID.
It's been everything, it's been stressful, exciting, painful, but I think the most important reflection is just leading a set of people that have given up so much to work for our country for 1 year. And despite the obvious personal strain it has had. Many of my staff have been infected themselves during the response. You know, we've kept at it, and that's really testament to the Nigerian spirit, that when we're really called on to confront the challenge, most of the time we do rise up to it.
The Nigeria Center for Disease Control has been working around the clock since the outbreak started in the country. This is the Connect Center, where public inquiries are managed 24/7. Between March and December 2020, the NCDC Connect Center received over 580,000 COVID-19 related phone calls. The peak period for the Connect Center was in June and July last year, where on some days there were 20,000 to 30,000 COVID-19 related phone calls coming in. But while there is a large focus on COVID-19, there are other prevalent illnesses and diseases that must be addressed as well.
Getting the necessary focus on the type of work we do has been a big challenge. So there has been an impact, right? This year, the extra resources that has come into COVID, yes, have been very good for our work generally, but we need to get away from just responding to crisis. There are many infectious disease threats that are still prevalent in Nigeria that really we should not be having in 2021. We still have cases of cholera, TB, diseases like monkeypox that have been, no one has heard of in other countries. So I hope that this outbreak really, in addition to managing COVID itself, enables us to refocus again on many other infectious diseases in Nigeria. Last year when we worked so hard to bring down the number of cases, we knew we were faced with a challenge, right? It took basically shutting down the economy to achieve that. And we looked around at other countries and what they were doing. And basically there were two types of countries, because you needed society to play ball with you. This wasn't something we could do. We needed people to play a role. And there were only two ways to achieve this. One is through cohesion, so forcing people to do this and to act in a certain way, which to an extent we did with the lockdown, but we knew we couldn't do that again because of the impact on the economy. The other way was to achieve a stronger social contract between the people and their governments. And so we at NCDC and with the PTF, we started a Take Responsibility campaign, encouraging people and informing them on what they needed to do themselves. And I think that worked for a while. But once we got to the end of the year, the time of the year, and it was a tough year. People had postponed their birthdays, their weddings, funerals, everything. So I think by the time we got to the end of the year, people just let down their guards. We saw all these events happening all over the place. And to an extent, that's the price we paid in the second wave. And inevitably, the deaths followed. And we lost a lot of people in Nigeria. But, altogether, I still think the outbreak could have been a lot worse. So the collective efforts of everyone in Nigeria has really helped mitigate the impact to some extent. And thankfully, numbers are receding again this year. We're now in February, and I'm hoping that trend continues, and thankfully we have a few more tools coming up, like vaccines. But
the government cannot do it alone, which is why the NCDC launched a Take Responsibility campaign in 2020. And the donation of private facilities, like the This Day Dome, have also been crucial in the fight against the virus. Commissioned as a testing, tracking, and isolation center in May 2020, the This Day Dome is fully self-contained, coming with a PCR laboratory, a fully equipped intensive care unit, and an incinerator. The private sector has played a large role in the fight against COVID-19 over the past year, launching the Coalition Against COVID-19, known as CACOVID. The first order of business was money. And of the fundraising goal of 120 billion naira, in 1 year, 35% of that has been raised, which is over 30 billion naira. 20 billion naira was initially earmarked for food alone, with an aim of raising 40 to 50 billion naira. The staple food items were to be delivered to Nigeria's most vulnerable by the government. But did all of this food make it to the people who needed it? In October and November 2020, it was revealed that rather than going into the households of people who needed them, large amounts of the goods were being stored under lock and key in various warehouses across the country. And is anyone being held accountable for the misuse of palliatives all over the country? Well, the Senate on Monday, the 22nd of February, resolved to issue a warrant for the arrest of the sole administrator of the Niger Delta Development Commission, Effiong Akwa, over his refusal to appear before it in relation to an alleged mismanagement of 6.2 billion naira on COVID-19 palliatives by the agency's management last year. When the pandemic was first reported in Nigeria, the country had just 3 national reference laboratories. 1 year later, and there are over 120 public and private testing labs across all states of the country.
We're doing right now about 60 to 100,000 tests a week, depending on the intensity of testing in that week. You know, at the beginning of this outbreak, we had 3 labs with the capacity to test for COVID, and maybe altogether they could do 200 a day. Spent a lot of energy this year doing that. I think we have over 120 labs now in Nigeria, 70 in the public sector, about 40 in the private sector, and 7 or 8 within big corporates. So I think the expansion of molecular diagnostic capacity in Nigeria is one of the really good collateral benefits of the response, and I hope will serve Nigeria very well for many years to come.
And while this is good news, one cannot help but question how much better the news may be if spending on healthcare in the country met minimal budget allocation recommendations.
The impact it had on health systems, I believe, took all countries by surprise and was a challenge for everyone. Remember, at the same time, the revenue also crashed in most countries, so you can't spend more than what you have, and because revenue also came down so badly, it was a challenge, particularly for developing countries, for low and lower middle income countries to meet up. What the government has done very well, you cannot say at all that they let us down, because the threat of the virus covered everybody, not just the health sector. It involved everyone. Everyone is at risk. So anyone who let down their health sector will be cutting their nose to spite their face, and that certainly didn't happen here. We had full support from government. In fact, we had to revise the budget altogether immediately the outbreak came, and repurpose a lot of funds that were meant for other programs and projects in order to satisfy the immediate needs we had at the time. We also had tremendous support from the private sector. They came in with full resources and bankrolled a lot of the activities that were carried out, as well as support we got from the UN system. They created a UN basket fund that helped us to meet the needs and meet the gaps that were there in the procurement of personal protective equipment, reagents, training, transportation, and a lot that we had to do. We even enjoyed the benefit of other countries too, bilateral. China gave us quite a lot. The United States supported us. And even philanthropies like Jack Ma was one of the first to, in fact, start bringing in supplies into our country. Not to talk of the African Union and the West African Health Organization. Everybody rose up to the occasion and did very well to make sure that we are where we are. We didn't suffer as would have been expected or would have been feared.
Not many people in positions of leadership expected COVID-19 to be at the very top of their agendas. Tracking, tracing, and ensuring the right treatment for an unknown virus was daunting for most. Dr. Tomi Koka, Health Commissioner of Ogun State, trained in gynecology, not infectious disease. When she moved back to Ogun from the UK to assume her role in office, she had no idea that 2 months later, she would be responsible for seeing the state through a pandemic.
So by profession, I'm actually a gynecologist and an obstetrician, and moved back from the United Kingdom, December 20th, 2019. So I walked into a public health crisis 2 months into starting the job. But it's been interesting, as I said earlier on, because initially it was one-to-one, knowing each patient that came into your isolation center. But as the weeks and months grew, it became responding to the system, developing a system where the patients are looked after regardless of my input. A day in my life would be, I'll be probably about 6 a.m. at the initial stage of the pandemic. 6 a.m. I'd get a phone call. There's a patient or there's an individual in a local government far away, about 4 hours drive away, that is exhibiting symptoms suggestive of COVID. Then I have to find a team that would then go out after that patient, try and actually verify if it's a true case of COVID-19, and then try and convince them. As you could imagine, the initial phase, people were really terrified, and there was stigmatization, people refusing to come into the isolation center. So we'll have to coax and cajole people, encourage them, and sometimes you had incidents of threatened arson from the people in the community trying to expel the individual diagnosed with COVID-19. So we had to deal with the medical issues and also the social issues. But in all of it, I have a great team that works with me, and it always makes the job easier because I can easily delegate to them the relevant individuals, and my day usually ends about 8 p.m. where when we have resolved one issue or the other, including transferring patients by ambulance. Ogun State is quite a large expanse, and it will take you probably 6 to 8 hours to traverse from one end to the other. And you can imagine trying to reach every patient, even patients in riverine areas where they're not accessible by road. But we've been able to reach all these nooks and crannies. And I usually, at the end of the day, I feel most days fulfilled, but there are days that I feel so exhausted that, but the next call makes it worthwhile when you have people expressing gratitude for a loved one that has been saved, and you feel that you've made impact in somebody else's life.
It's certainly been tasking, but Dr. Coker is not giving up.
I have a lot of hope for the next 1 year, particularly around the fact that we do have vaccines coming into the country. Last year, we had never come across this virus. It was novel. We didn't really know what we were dealing with. We didn't know how to deal with it. And unfortunately, Ogun State was where the first case presented itself. But over the last 12 months rather, we've learned how to deal with it. Obviously, it's constantly evolving, so we have to keep up with it. But we kind of have a routine and a system in place with dealing, the testing, the tracking, and the treating. So I feel very comfortable with my team in managing the virus, and we do know that it's most likely going to be endemic. It's not going to go away immediately. So we're geared towards responding to it as an endemic disease in the future.
I think COVID will still be with us, but it'll be on a much lower level. But this is pure guesswork, maybe an educated guess. But I don't see this going away anytime soon. I think it's going to go down. We'll start to live near normal lives again, and we'll get used to COVID, and like we are used to the flu and things like that. And life should be almost back to normal. I don't think we're going to have this kind of pandemic again, but you never know.
Dr. Yemi Johnson is the Medical Director and Chief Executive Officer of First Cardiology Consultants. And in the early days of the pandemic, the hospital grew a reputation for treating high-profile individuals who tested positive for the virus.
This thing started in February. I can't remember the exact date. But just before it started, we saw what was going on around the world. and saw COVID was going from country to country, and we knew, my partner and I, Dr. Ogunyaki, knew we were not going to escape. So what we did was get ready. We do ICU work. We knew we were not going to take care of the regular COVID patients, but those who got critically ill would probably come our way. So we got ready. We got our ICU prepared. We got all the infection prevention protocols in place. Got Lagos State to help us out with that, and a charity group called DRASA, which is named after the Dr. Ameyo Foundation. So they helped us set everything up for the infectious disease part of it, and we got our ICU equipment upgraded and also installed cameras on every bed so we could remotely look after the patient. So we were ready when it came. We were ready, and one reasons why we started getting the patients first was we were the only ICU at the time that was actually prepared for COVID. So they started coming to us. Now, we got a reputation for looking after the rich and all that, which is interesting. But yes, COVID care is expensive. So it was quite expensive. So we couldn't look after those who didn't have the means to do it because we had to buy our equipment ourselves. So it cost quite a bit to look after the patients. And yes, the elite came, and some didn't make it, and that all went around social media, giving us a reputation that the elite came here to die. Some even called me a secret weapon and things like that. But it was an interesting time, very stressful. But I can say our mortality rate at the time, number of people who died in the ICU was about 15 to 20%. In the rest of the world, the Western world, it was more like 60% of the patients died. So we think we did a good job. And patients still kept coming. We're always full. So I think most people knew we did the best we could, considering what was going on with COVID.
And this is a pandemic that has spread more than we even know. The Nigeria Center for Disease Control, in partnership with the Nigeria Institute for Medical Research, conducted a survey on household seroprevalence in terms of COVID-19 in the country. The findings you're about to hear are shocking.
Yeah, so, the thing with this new virus is its unpredictability, right? In 80% of people, there are absolutely no symptoms. So there may be no reason for you to even try and do a test at all. For some have mild, moderate, and a small proportion of individuals have severe symptoms. What that means, and despite that, even those without symptoms can transmit. So we recognized from the very beginning that our surveillance system would not be able to find all the cases because asymptomatic people very often don't go for testing. So we needed to do a survey to understand how many people had actually been infected in our population, and we're completely unaware of it. So together with our colleagues at NIMR and supported by the US CDC and University College London, we carried out this population representative survey in 4 states, in Lagos and Nasarawa, Gombe, and Enugu states. And through that, we've now come up with an estimate of about 1 in 5 individuals in Lagos that are likely to have been exposed and infected by the virus without even knowing they had.
Medical school may not prepare most students for a pandemic, but that's exactly what students at the Lagos University Teaching Hospital, also known as LUTH, are experiencing firsthand.
The announcement of the pandemic's arrival in Nigeria filled everybody with a lot of awe, a lot of what will it take? There was anxiety. There was the need to plan for what we did not know. Yet there was that urge within us as a community to do something. Because if we didn't do anything, we could perish. The anxiety on the part of groups, unions, doctors, nurses, was palpable but understandable. Nobody wants to die. But we knew that with the knowledge and the years of experience we've had handling minor epidemics, we could leverage on all that to confront even this unknown. And we won the agreement by telling members of the 3,000 members of this community, that if we didn't rise against COVID-19 as one body, COVID-19 will surely pursue us into our homes, and then that wouldn't be fun. So we all started training. Even before we saw the first case in the hospital, we started training. And luckily we had a big building, a building of 120 beds, that we said, okay, we'll put this down as a last case scenario. And that helped us a lot.
Professor Chris Bode is the Chief Medical Director at Luth. When the Yaba Infectious Disease Hospital started to fill up, Luth started treating patients with COVID-19. So far, there have been 869 COVID-19 admissions at Luth and 752 discharges. And unfortunately, 102 people have lost their lives here.
News filtered in that Yaba was filling up and Luth had to get ready. We then psyched ourselves up and knew that, yes, this was the moment we needed to do something. And we held meetings upon meetings and we appealed to each other. We rehearsed many times. And then we announced on the 7th of April 2020 that we were ready to take on cases of COVID-19.
Each ward can take 30 patients, so that's like 90 spaces to 30 for confirmed female, 30 for confirmed male, and 30 for those you're suspecting that they could have COVID, and also 19 all. Of course, that's apart from the ICU that has 3 more spaces for patients who are.
Things are calmer now that the curve has flattened from the second wave of COVID-19 in the country. There are 15 patients presently on admission at the teaching hospital. 4 confirmed males, 5 suspected cases, and 2 patients in the intensive care unit. But when the first wave started and bed spaces started to fill up, controversy kicked in.
There's been some challenges. I must tell you that we had to focus on the care of COVID-19 patients. And as practiced worldwide, we also had to scale down on the care of other non-COVID patients. That was for 2 reasons. One, the resources, both manpower and other resources, could not have sustained both pari passu. 2, doctors were afraid of. Doctors, nurses, hospital workers were the most at-risk group of patients.
Hospitals running out of bed space has become a common global narrative over the past year. But hospitals burning down is not. First Cardiology stopped treating patients for COVID-19 in October in order to focus on their regular business of cardiology and cardiac surgery. But a month ago, there was a fire outbreak in what used to be their COVID-19 ward. I had visited this ward just 5 months before, while working on a report. Walking into it in its current state left me covered in goosebumps.
Right now, we are no longer taking COVID. Unfortunately, we had a fire outbreak in the inpatient ICU section, so we're still in the middle of repairing all that, so we're not able to take any COVID patients at this time.
Thankfully, everyone present in the ward was safely evacuated and no lives were lost. And on the topic of saving lives, can we envisage an end to the pandemic without a global vaccine strategy?
The story will continue after this break.
By the 24th of February 2021, 216 million doses of COVID-19 vaccines had been administered in 21 countries. The United States is currently leading the way, with over 65 million doses administered, followed by China with 40.5 and then the European Union. When Ebola exploded across West Africa in 2014, it took more than 5 years for drug regulators to approve a vaccine. But the novel coronavirus tells a different story. The world has just experienced the quickest vaccine turnaround in human history, and the race for a vaccine has certainly been a successful one, with several vaccines approved by regulators and available on the global market. And the distribution of vaccines has been inequitable so far. 10 countries alone have administered 75% of the vaccines administered to date. COVAX did just deliver their first vaccine shots with a shipment to Ghana. But right now, the only African country with a license to manufacture vaccines is South Africa with the Johnson & Johnson vaccine.
The President had always stressed that we should work towards self-sufficiency and towards reducing import dependency and to revive all the industries that we have in Nigeria. In the health sector, we have the pharmaceutical industries, which are largely in private hands. They are doing well. We are doing everything we can to encourage them. I will believe that things will improve for them in due course. But Nigeria used to manufacture vaccines, and like so many things in the country, that industry collapsed in 1990. And this particular regime of President Buhari is reviving that vaccine plant, but this time in collaboration with the private sector, and formed a company called BioVaccine Nigeria Limited, and this company is working at producing vaccines, and in fact not only producing, but in fact looking to getting patents to produce locally, technology transfer. So we are ready to work with any country, any manufacturer who is ready to come and set up a plant here. Government will join, invest in it if need be, and begin manufacturing of vaccines. So we have already spoken with some countries who have shown interest, who have said, yes, we are ready to talk about it and transfer technology and the investment to begin manufacturing vaccines in Nigeria, which will serve at least the West African sub-region, if not the continent.
So we've got to take the lead from the federal government, and the government is dealing directly with the vaccine manufacturers. So it's government to government, and they will broker our deals for the country, get the first consignment, give us our allocation. We, along with the federal government, are creating a prioritized list of who gets the vaccines. So obviously we want to target our frontline workers, and then we want to target the most vulnerable in community.
And the effects of this are felt far and wide. The world's richest countries have ordered 1 billion doses more than they need. After all, human instinct is self-first. Israel has, however, pledged to send thousands of spare coronavirus vaccines to foreign allies, which will certainly help. And with Africa passing the 100,000 death mark from COVID-19 this month, organizations like the World Health Organization are doing what they can to ensure that countries on the continent get the help that they need.
Now the time has come for vaccine and another new tool with more hope, and we look very much forward to support Nigeria to roll out the vaccine so that at least we can end the acute phase of this pandemic.
Nigeria was hopeful of receiving initial doses of the Pfizer vaccine through the WHO-led COVID-19 Vaccines Global Access Initiative at the start of February this year. But unfortunately, the country wasn't shortlisted.
We are getting vaccines from three main sources. First is the COVAX facility, which is providing vaccines at no cost to 92 advanced market commitment countries, to which belong the low and lower middle income countries, and Nigeria belongs in there. And this vaccine is put together by World Health Organization and Gavi. The second is the African Vaccine Acquisition Task Team, a child of the African Union, led by the South African president, to pull together vaccine resources to procure vaccines for African countries to use a whole of Africa approach, so that not even under-resourced countries will be left behind. So this facility has procured, as of what we have learned yesterday, about 570 million doses, and that's quite a lot for the African continent. Much of it is bankrolled by the Afrexim Bank, which now allows allocation according to population to African countries. Now, this is an excellent way of making sure that our continent is secured and our population is secured. And if we add the vaccines that we can get from that facility to what COVAX is giving us and other sources, we hope to be able to cover 60 to 70% of our population with immunity, with immunization. So that is the plan, the resource that we have at our disposal right now. As for when the vaccines will arrive, well, it depends on those who are procuring these vaccines for us. But it might be any time now, maybe tomorrow. But we are ready.
Nigeria was indeed shortlisted for Pfizer vaccine. What happened, it's related to the global supply issue. So there were like 1.2 million doses to be shared among 72 applicants.
The inequitable distribution of vaccines is certainly going to hinder the world's fight against COVID-19. And then there's the issue of fake vaccinations.
The fake market is real. It's difficult to tell what's fake and not fake, which is why the government wants to deal directly with the manufacturers and their recognized distributors. So we've had a lot of offers we've got 5,000 doses of vaccines. We've got hundreds of offers like that. But government prefers to deal directly with manufacturer or their recognized distributors, and also make sure that the cold chain is maintained, because you can have an original, and if the cold chain is broken, and there are ways to determine if the cold chain is broken. But if you're not dealing with reputable people, you could have a cold chain break that can be disguised. In that case, you'll just be vaccinating a dud vaccine. So very important that we are dealing with legitimate manufacturers, their distributors, and people who have expertise in cold chain logistics.
The federal government of Nigeria has stated that it will be responsible for procuring all vaccines for distribution and administration to avoid fake vaccines. But can states procure their own?
What you have to think of is right now we have no protection whatsoever. If we don't use the vaccine, we're all going to continue to have to wear the mask, and you don't know who the next fatality is. We do know that the AstraZeneca, it doesn't, it's not effective with the South African strain. However, it does confer a certain level of protection, which we wouldn't have if we didn't actually take the vaccine at all. So in my mind, I think the first step is to actually accept what we have at the moment. The data that's coming out suggests that the vaccine has to be repeated. It's not a lifetime protection, immunity. So like the common cold, which is another coronavirus, in England, you have to actually have your flu vaccine on a yearly basis. That might be what we have to do. So I think we should have the first dose, the first couple of doses, and then review the situation. My message to the public is we should take the vaccine, the AstraZeneca vaccine that the federal government is providing for us.
You cannot permit people to just run along to a pharmacy and get a jab and disappear back into community. So it's got to be controlled by the government. We've got to know there's got to be a digital register of everybody. We've got to be able to monitor who you are, where you are, make sure you come back for your second dose, and make sure we can keep track of any events that you may experience as a result of the vaccine. So it's going to be entirely government-led. We will purchase more vaccines if what the federal government gives us is not sufficient for what we deem to be our priority lists. We already have our ultra-cold chain logistics in Lagos because it's part of the infrastructure we were building up over the past few years.
So states can't procure their own just yet, but seem to have plans to if initial allocations from the federal government are not enough. And how much hope do medical doctors in the private sector have in the transparent and equitable distribution of the vaccines in Nigeria?
I have concerns, yes. As you know, our healthcare system is not just COVID. COVID has brought out the deficiencies in our healthcare system, has brought it out to the open. Healthcare system is pretty much broken. You notice they threw a lot of money, CACOVID and guys threw a lot of money into the system to treat COVID patients. But healthcare, it didn't improve the healthcare system. We have got to fix our system. So now what is happening is the government wants to be in charge of procuring all the vaccines because they're worried about fake vaccines coming in and things like that. So they're going to have to go through NAFDAC and things like that. Now, this is all good in the ideal circumstances, but we know what happened when government was in charge of palliatives. They didn't get round. So I'm concerned that if government is totally in charge, there's going to be a problem with distribution and logistics. That's my major concern. But let's see how it goes.
And without herd immunity, COVID-19 remains a threat to the nation. Companies like Helium Health have been very busy ahead of the vaccine rollout in Nigeria. I sat down with co-founder Bola Tito Ovia to understand more about their involvement.
So Helium Health is a healthcare technology company that's based in Lagos, Nigeria. Our mission is to accelerate Africa's transition into a better healthcare system using data and technology. And with the COVID-19 vaccinations that are coming in, as a health tech company, one of the things that we want to be able to do is work with government to help them with their logistics. We know that these vaccines unfortunately weren't tested enough on people in Nigeria or people in sub-Saharan Africa. So there's still a lot of information that's still coming out about, their side effects and what's going to happen in the long term. So in an ideal world, we would love to be able to build the tech to know, okay, let's track and trace to know exactly where the vaccines are going to, who they're going to around the country, and for those individuals to be able to provide real-time feedback to the government. When COVID-19 happened, we actually were very excited. Not that people were dying, but of course about the opportunity that everybody was now talking about healthcare. We've always believed that, different sectors in the Nigerian market, banking and finance, telecoms, oil and gas, were able to leapfrog so many challenges because of data and technology. And finally, now that healthcare was on the top of the mind for everybody, this was really our chance to show that technology can help us be able to overcome and actually help us deal with, maintaining this pandemic.
Health technology is key. And tracking and tracing is not just for cases of COVID-19, but also for vaccines administered against the virus. The work that Helium Health is doing is important. Securely keeping data on Nigeria's vaccine rollout is crucial in the fight against COVID-19.
The story will continue after this break.
The new norm is to be very diligent about community surveillance, to be very diligent about how we develop Lagos State as a mega city in terms of access to sanitation, urban planning, controlling of populations, improving our health systems so that we can become more resilient. The stronger your health system is, the less vulnerable you are.
The first lockdown. It seemed like a holiday to many at first, but as the weeks went by, the reality kicked in more and more. For a lot of students, staying out of school took a huge toll. And Dr. Ngozi Onya does not believe that the future of any child should be compromised.
I think the children should go back to school. There are many considerations. We're mortgaging the future of the children just to keep the older people safe. I don't know if that's really, really fair. Children are not the super spreaders we thought they were. Children generally don't fall very ill with COVID. So the main risk for the children is that they might spread and infect their older relatives. So I think the wise thing to do is keep the children away from their older relatives if you must, particularly for symptomatic children. But I think the children should be left to go back to school. We can't mortgage their future just to preserve the lives of aging baby boomers. So we'll find other ways of protecting ourselves too.
And Bobby Odunsi had just opened her organic food store 3 weeks before the lockdown. So this is the only normal her new business, Amazon Organic Foods, really knows.
We'd only been open for about 3 weeks when the pandemic hit. So for us, it was about mobilizing the staff, which was, I think, the very first thing we had to do was to mobilize enough staff and to keep them safe, to create a safe environment for our customers and for our staff. Trying to get things done hygienically was one of our biggest challenges. We needed to keep a safe distance from the third parties coming into the store. And the way we were set up initially we didn't have any of those challenges as challenges that we needed to mitigate against. Yeah. So getting them in, sanitizing everything, sorting it meant that our response time was a lot slower.
So during the first initial lockdown, in terms of your staff, your employees, were they staying here, going home? What was the situation?
Okay, so essentially we gave them 48 hours notice. Once we knew there was going to be a lockdown, we asked them all to go home. We gave them a choice. You can stay or you can go. It doesn't mean you're going to lose your job, but if you're going to stay, you're essentially going to be locked in.
Essential businesses must go on and adapt to the new normal. Stephen works here at Amazon Organic Foods. And when the lockdown kicked in last year, that was it. He couldn't leave his place of work until it was lifted.
The lockdown, it was stressful because we didn't expect it. We just came in. We just had to start to adapt to it. And at that point, trying to reach out to customers, and because we had high demands, customers couldn't come out to get what they wanted, so we had to be the one to deliver to them. So it was stressful. We had to work back to back. We had to stay up for hours trying to sort out and to, make our customers comfortable, make their orders okay so they don't have to complain. And at the same time, we got to learn a lot because we were able to communicate with the customers online. We were able to know more about our produce, know more about what we sell, our product, because we were selling. And it was okay, it was fun.
And for Nigeria, not just essential businesses, but most businesses due to a large informal sector. So much so that regardless of a second wave, with higher daily case rises than ever before, the government did all that it could to avoid locking down again. But many people are still falling seriously ill. Pastor Obikwe Nwandu had been in Luth's COVID ward for 10 days when I spoke to him. His gratitude, not just for the medical professionals, but for everyone that's looked after him during his stay, brought him to tears.
The caregiver that takes care of me, I haven't seen him go home ever since I've been here. These doctors, by 8 a.m. they're here. By 12 midnight they're here. When I have to go for dialysis, the same doctors who were with me by 10 in the morning are with me till 1 a.m. And before 8, 9 in the next morning, they're here again. These guys are something else.
And the new normal also means investing heavily in medical research. At the Nigeria Center for Disease Control, genetic sequencing has been a large focus.
So, every living thing is made up of sequences. Viruses are very simple organisms, and it's the sequence of that virus. Why it's so important is really what was used to start the development of vaccines against it, for instance, the diagnostics in terms of how to detect it. The thing with viruses, and specifically RNA viruses, of which this is one, is they replicate fairly frequently. And the more frequently you replicate, the more your mutations happen. And mutations happen, new variants, and i.e. a new set of sequences that define that virus happen. So we knew from the very beginning. We sequenced the first sequence out of Africa together with our colleagues at the Africa Center for Excellence in Genomics. They have the most advanced sequencing capacity in West Africa and work very closely with us. So we started doing that slowly, and but over time, globally, following the science, we realized, listen, there seems to be increase in transmission related to certain types of the virus or variants of the virus, and that was first found in the UK. Scientists there found that a specific new variant, so a realignment of sequences in that new virus, which was then called the B117, was seen to be linked to increased transmission. And so we then started looking for that variant, which is now called the variant of concern.
And while scientists continue to produce empirical evidence that can help us to understand more about the virus, medical professionals continue to do all that they can to save lives. Low oxygen supplies in the country have cost several lives since the outbreak of the pandemic. And the government is now constructing 38 oxygen plants across the country. But could this have been done earlier?
Well, the problem was not detected sooner, so you become aware of the problem and then you respond to it. And I must say that this government has been extremely fast and responsive when it comes to such issues. So the government very quickly, once it became clear that oxygen is a problem with COVID-19, quickly approved the setting up of 38 plants. That's a lot. Before now, we had a certain percentage of oxygen use, which was satisfactory for the needs at the time. But COVID-19 has shown that you need high-flow supplementary oxygen for treatment. At first, it was thought that we needed ventilators, but ventilators have proven not to be actually the solution, but rather high-flow oxygen, which we are responding to very rapidly.
President Muhammadu Buhari approved 6.45 billion naira, or $16.9 million for this project. Oxygen shortages are not unique to Nigeria. Several countries all over the world are experiencing the same problem. But the World Health Organization has actually been warning of oxygen shortages in poorer regions of the world for years. And as far as Dr. Malombo is concerned right now, we must accept our reality and deal with it appropriately. And what does the future look like to him?
So it's an opportunity to learn, but also a lesson that we should always be prepared. We've been preparing for the next pandemic flu. It hasn't come yet. COVID-19 came before. We have an opportunity to think through and better prepare for the biggest pandemic, which I believe is yet to come.
We've certainly come a long way in the past 365 days, but the road ahead is still quite a stretch. Over the past year, we've seen progress in the mobilization and development of Nigeria's health sector, but we have also seen a lot of our failures. Medical doctors have had to make ethical decisions that they haven't had to make in all of their years of medical practice. We've also seen how hard it is to protect and feed Nigeria's most vulnerable, how hard it is to get the message across that COVID-19 is real. And as we enter a second year of COVID in Nigeria, with respect to those that have lost their lives, we can have solace in the fact that we've passed the hardest stage, and we can get through this. Thankfully, there are now vaccines on the global market being not just distributed, but also administered. And even though we may not know exactly when, we do know that vaccines are going to start trickling into the country in the next few weeks and possibly even days. But until we've managed to achieve herd immunity and until we are safe, continue to mask up, socially distance, wash your hands and keep safe. Leila Johnson Salami, Arise News, Lagos.